So during this video, we're going to go through signs and symptoms of labor, when you should go into the hospital, what you might want to stay home, and what might emergently bring you into the hospital, as well as just the general outlines of what labor might be like for you.
Contractions, those are the biggest things that we look for, and we look at regularity, frequency, and a pattern. We give women a guide as a 5-1-1 rule, so they're about every 5 minutes, lasting for a whole minute for an entire hour. If you sit down and rest and they go away, that's a sign that maybe labor is beginning to think about it, but it's not quite there and ready to come on into the hospital. Question that we all wish we had the answer to. We just don't know. We do know that it is a slow progression, or at least a progression in discomfort, in progress of cervical change. It could be as little as a day. It could be as long as a few days.
And we tell people it's totally okay to be sent home. It might feel frustrating, but we know that it's best that when you're in that early stages of labor, if everything else is safe and looks fine, to labor at home. Because as we know, labor is a progression, and we want to have you in the hospital when things are getting more active.
Breaking that bag of water is one of those signs that everyone waits for because they're nervous it's going to happen in the grocery store or in a restaurant. And it's hard to know because sometimes it is that big gush of water and sometimes it is a little trickle. But because it's so variable, I always tell women that if your pad becomes wet and over time increasingly becomes wet, that's a reason that you want to come to the hospital or call your provider and see if it's your bag of water broken. If you are curious and really questioning if it is broken, it's always best to have it be checked. And again, potentially be sent home and say, yep, that bag of water isn't broken yet, but it may be time.
Most providers will advise that you head on into the hospital, and they'll offer you some medication to help induce those contractions and move your labor along. And the main goal behind that is to decrease the chances of having an infection. Other people are somewhat comfortable with waiting for labor to start on its own, and we know that most women are in labor with their first baby by about 12 hours after their bag of water has opened up. But again, it's a joint decision that you make with your provider, so we very strongly suggest that you call your provider if this should happen.
We encourage keeping yourself fed and hydrated while in labor, knowing that some women feel nauseous. So you want to plan on food and calorie intake that actually is mild but gives you good energy. The one time that sometimes it's recommended to not have solid foods is if you begin to request for anesthesia or have pain relief medications. But you can still drink and have liquids.
It's up to you. It's your room, your rules. So whoever you think is going to be most helpful to you in labor, that should be your team. Also, we suggest checking with your hospital you're planning on delivering at to ask them about, is there a restriction on the number of people that I can have in my room? That will help guide your choices as well. We usually say that you should not bring too much. The hospital has pretty much everything that you might need. So you can leave at home that 2-ply toilet paper, anything that you think that you need just to make yourself a little bit more comfortable is totally fine.
If you're a planner and you want to know like how to pack and how to plan to bring, what bags to bring in, I usually recommend pack a labor bag and a postpartum bag so you don't feel like you're bringing your bedroom in with you, but you have the personal comforts that you want.
I would say you should want to bring some snacks into the hospital too, for you and your partner. Sometimes you deliver really late at night when nothing is open and there's not a lot of options.
When you're close to when your baby's due, there are some warning signs that should make you concerned to want to come into the hospital and be checked and not to ignore these signs. One sign would be having vaginal bleeding like a period. When contractions begin, you begin to have pink spotting potentially or red mucousy bleeding, but it's not in the consistency and amount like a period. So vaginal bleeding, I would always call your provider and talk to them about and see if this is a concern to come on in. Another sign is if you don't feel your baby moving. Our recommendation is to also do a kick count where you sit down or lay down, drink some cold water and really feel your baby. If you can feel your baby move 10 times in 1 hour, then your baby's doing okay. But if it doesn't hit that, then we definitely want to see you so that we can monitor your baby.
If you had a headache, that's probably the worst headache of your life, and you take Tylenol and it's not relieved, we'd want to have you come in and get checked out. Another thing that we'd like you to know is if you started to see spots or had really sharp pain in this upper area on the right side, we'd want to have you come in and get checked out too.
Now that we've gone over all the signs of when labor will begin, I hope that you feel a little less anxious about when to stay home, when to recognize when to come into the hospital, and now feel excited and ready to welcome your baby into this world. And also to know, please don't hesitate to call your provider if you have any questions or concerns, that we're all in this together and we're a team to help bring your baby into this world together.